patients who thought they had recovered from the coronavirus are testing positive again just weeks later. It's raising questions about whether people can get reinfected and how long their antibodies can last. NBC News health and medical reporter Erica Edwards spoke with some of those patients. Erica, what did they tell you, and what are doctors saying about these cases?
Yeah, so these were patients who were diagnosed with COVID-19 back in March. For whatever reason, they had to get tested again in subsequent months, April and May. They had to get one woman, for example, she's a nurse. She had to have 2 negative tests before she was able to go back to work, which is, of course, important to her. She had those negative tests, but then later on in June, tested positive again. And it's really not clear what's happening. And so far, there's a lot of anecdotal reports of this happening. Either they had false negative tests, or maybe the virus, that first virus, was hiding somewhere in their system, undetected before reigniting again and turning into another inflammatory process, or they truly were infected a second time, which would be surprising because it was assumed that at least for a certain period of time, patients who had COVID were protected because they had built up the antibodies to that virus, Allison.
Erica, do doctors have a sense, do researchers have a sense of how long antibodies can last and whether it's the same or varies among people? I feel like we're so unsure of what it means to have antibodies and how long that could potentially protect you.
Right. I mean, that's a tough question because, of course, we're only 6 months into this pandemic, and doctors are, of course, discovering how the virus acts in real time, learning as they go. Now, historically, coronavirus antibodies do offer some level of protection for a certain period of time, but that does wane. And now there are studies that are coming out saying that people with COVID-19 antibodies may only have them for 60 to 90 days after infection. Of course, that's terrifying for people who have had COVID-19. They've been sick. They don't want to get sick again. So it's quite frightening, Allison.
Yeah, I mean, when you think about that, if the antibodies don't last longer than that, if people can get infected more than once, I mean, what does that mean for vaccines, for the concept of herd immunity? I mean, it seems like this could have a much larger impact.
Right. So for herd immunity, you would need to have about 60% of the population immune to a certain virus before it would offer that overall community protection that we were talking about. So if immunity is fading so fast in people, you can just throw that concept of herd immunity right out the window. Vaccines, sort of the same idea. If natural infections can't offer lasting protection, it's kind of unclear how long a vaccine made in the lab would also offer protection to the population. So there's questions about whether you would need boosters to the vaccine, how many boosters, when you would need to administer them. There's still so many unanswered questions. Now, of course, there's a lot of really promising vaccine research coming out. It's still early, it's promising, but it's really going to be several more months, maybe even early next year before we have all those answers to those questions. Allison.
Yeah, we still have so much to learn here. Erica Edwards, thanks so much for your reporting.
Thank you.